Since the minimal residual disease assessment was introduced in multiple myeloma for the first time in 2016, it was also thought that it was worthy to evaluate minimal residual disease outside the bone marrow by imaging techniques. And the reasons for this resides in the fact that in myeloma we are assisting to a spatial heterogeneity. So it is possible that the disease is negative in the bone marrow but not negative in the focal lesion, in residual focal lesion outside the bone marrow. And the prognosis of patients with positive focal lesion after therapy is worse than the prognosis of patients who achieved the complete normalization in the focal lesion. So we have to use imaging technique, and of course for this purpose we can only use functional techniques that are able either to evaluate metabolic response or to evaluate bone marrow infiltration. The technique that nowadays has been mostly used is PET-CT, because of its capability to distinguish between fibrotic tissue and active tissue. And we have several prospective studies that demonstrated the prognostic relevance of PET-CT negativization after therapy. So we have several strong and robust data from independent prospective studies. However, of course, neither technique is perfect, so also PET-CT can fail for this purpose, for example, in patients who are not trapping the FDG in the cells. And so there is another raising technique, which is functional MRI, in particular diffusion weight MRI, that is able to evaluate the difference in perfusion of the tissues, so in the movement of water molecules. Regarding this technique, there are several studies as well on small number of patients, mainly retrospective, and I may say that the interpretation of the results is less clear. However, it has shown to be very sensitive and to be able to discriminate patients with residual focal lesion or not. Of course, we miss by now a prospective comparison between the two techniques, so we are not able nowadays to say which of the two is the best or the winner, or if we need both in several cases. And another important point is the standardization of these two techniques that is ongoing. In particular for PET-CT, a huge job has just been concluded on two prospective trials, so we were able to find an interpretation criteria. And for diffusion weight MRI, as I said, is ongoing. And also we miss, of course, to introduce all this data in the daily routine clinical practice, and so to understand how to use these results eventually to modify therapy.